to all doctors and our clutch team members and all other hospital staff. It is my privilege to welcome you all on behalf of Clutch Health. Clutch Health's motto is to make hospitals healthier, and it is first of its kind in India, which focuses on hospitals in 5 different important verticals, namely operations, quality, insurance, biomedical equipment, and human resources management. Today's session on social media marketing will help the hospital's community to understand what social media can do to the hospitals in terms of new patients and brand building. Whether social media marketing will help the hospitals in generating new leads. After this session, we will be in a position to take a call how far to go in social media marketing. Social media marketing right now is the need of the hour for the hospital community to understand what to do. Now, I would like to welcome Mr. Prashant, our Excellence Manager, Human Resource, to welcome the speakers and moderate the session. Welcome, Prashant.
Thanks, Mr. Jagnesh, for the warm introduction. In today's digital-driven environment, technology makes the internet extensive across the globe, and social media is practically a national pastime. Technology empowers the individual people of every age group, anywhere, anytime. So embracing social media is a business and marketing must have for healthcare. So how? Here I welcome our first speaker of the day, Mr. Shubhas, co-founder of Force Technology, Force Infotech, director of Desmos Lab, who has 16 plus years of experience in handling techno tools, and he has been awarded by Asia Pacific in 2018 as a best starter partner for implementing Odo Enterprise Business Solutions. Over to you, Mr. Shubhas.
Thank you, Prashant, for the warm introduction. I first of all thank the Clutch team who gave me this opportunity in order to talk a bit about what I know with respect to digital marketing. And I thank everyone, every participant who are spending their time on a Sunday to listen to us. Thanks a lot. So shall we get into the presentation? Yeah, thank you. I'm just sharing my screen.
Yeah, please.
I think my screen is visible to you all.
Yeah, clear. So if you go on to the full screen mode, it will be more predominant.
Yes. So here we go. Basically, here we are going to learn about digital marketing. So there are a lot of terms which talks about digital marketing. Normally, people who are not aware about the digital used to call it as social media marketing. But in order to make it precise, so in order to teach about digital marketing, as a common man, we are introduced to a lot of social handles like Facebook, Twitter, LinkedIn, YouTube on a day-to-day basis, using a gadget, using a smartphone. We will be consuming these kind of apps. So that is why people have trended the terminology as social media marketing. But in general, what is digital media marketing? Apart from what we see on a social media platform, there are a lot of things which can be brought into digital era, and then that can be used, and that particular content can be used in order to market anything for that matter. So that is why we say the world is not bigger when you go digital. So because nowadays you could see even right from a kid to a old guy using gadgets, and no one teaches them. For example, previously software has to be taught to someone the way it has to be, and now we are self-learners. It is self-explanatory. When we use Facebook, when you use WhatsApp, when you use YouTube, it is being very, very self-explanatory that even an old people and even a kid at 5 years old, they learn on their own. So that is why the world is going digital. So let's go into the next part. When we did a small study, so a small survey for certain organizations who have already implemented digital marketing, we asked them a basic question, whether your organization have a digital marketing strategy. Digital marketing is nothing but when we had a traditional marketing, we have a traditional marketing which needs to be followed, which cannot be killed, because that's the base of any marketing for that matter. And digital marketing started complementing the basic traditional marketing in the before 10 years. So before 10 years, when the digital marketing got a boom, when we thought like we wanted to put a question to few people, they came out with certain answers saying that they don't have a proper strategy in order to implement digital marketing for their own company. And few people told that they have a strategy, but it is not integrated into their business plan. So it is not working together. Their direct marketing, their traditional marketing is not integrated with digital marketing, and they are not working together. And few people told yes, very less people, 16% of the people told yes, of course we have a strategy for digital marketing, and then based on which we have implemented. And those people have been successful, because any digital marketing for that matter should have a proper plan in place. It is not a traditional market. Even traditional marketing will have a lot of plan, because your own salespeople, even though you run hospitals, if suppose you run pharmacies or any other healthcare startup or any health oriented business, your own salespeople will definitely have a weekly plan, a daily plan, a monthly plan, a calendar to be worked on in order to achieve your sale or achieve your goal. Similar to which, similar to which, digital marketing should also have a proper plan, a strategy written in a piece of document for that matter to be implemented for your organization. So that is the thumb rule before we get into the presentation, which I wanted to pass as a message. And yes, have you all heard about a word called funnel? Funnel is a common word which every salesperson used to use, because any salesperson for that matter will talk about funnel, building a funnel. So generally people will have the database. For example, I am into computers business. I want to sell computers. Basically, I'll have the database of corporates, database of institutions, database of students, and database of finishing schools. Only then what I can do is I can actually work on that funnel to convert into a lead and then make a sale. So this is a traditional funnel. But when you work on a digital marketing, there is something called a modern marketing funnel. So what is the funnel? Nowadays, you could see, I would like to talk about certain real-time examples. Even if suppose you wanted to buy a mobile phone for that matter, people doesn't go to the shop and blindly look at the model and then they just buy. Before getting into the shop, what they do is they used to read a lot of reviews. So today's world is basically a review world. So anything we buy for that matter, even before going to a doctor, even before going to a restaurant, what we do is like we just take our mobile or we take our computers, go to Google or go to some sites, check about the reviews about that particular person or the product or the service, and then we decide whether we have to go there or not, because we have multiple choices. Even you can search for people, service, and product on internet. So that is the modern marketing funnel which is being in practice, and every business now needs a modern marketing funnel for that matter, including healthcare. So basically the modern marketing funnel works in such a way, like how you see on the screen. What we need to do is like we have to create impressions before someone has to visit our store physically or even virtually. For example, websites and mobile apps are becoming your virtual store. So what we need to do is like people are spending a lot in order to create impressions, and that is called branding. So in order to brand yourself, in order to brand your product, brand your service, brand the people, and brand your company on a whole as an proper image, you have to create a lot of impressions. Based on the impressions, when you spend on branding, it will create visits to the physical or the virtual store, and then it gets refined into a lead, and then the sale will happen. And it is not just sale. Previously it was word of mouth marketing, and now it is called a review based marketing. So everyone who's being a consumer, once after they avail your service or sale for that matter, will definitely tend to write a review. So you can see the entire world is becoming a review based marketing sale, and that is called the modern marketing funnel. And this will be implemented, this can be achieved only if you embrace a proper digital marketing for your company. So now I would like to talk more about digital marketing. Now let it get into a slide where we just try to understand what is digital marketing. Yes. So this is digital marketing. So digital marketing has 7, 8, 9 elements. But for this particular presentation, what I thought was since you people are coming from the healthcare background, we thought we will talk about relevant marketing, relevant digital marketing, which will be applicable for your own business or your own vertical. It starts from social media marketing, because social media marketing is a very big tool where you have a lot of products like Facebook, Instagram, Twitter, YouTube, LinkedIn. You can use all those social media channels so that you can start using your digital marketing for, basically you can see, maybe you can do a crisis management, because now we are in a COVID era where you can talk about how to overcome a pandemic crisis. So where you could even see like a lot of doctors giving us tips what to do, what not to do, do's and don'ts. So like there are many things. Maybe you can do public health monitoring when it comes to healthcare, and you can give a lot of information. For example, if you say how to overcome a dementia or any disease for that matter, how to overcome an obesity for that matter. So social media can be used to create awareness. It can be used to engage with people, and also you can use it for a lot of purposes where you can start doing your surveys in with respect to public health monitoring, and hell a lot of things can be achieved using social media marketing. And also another thing what you can do is, if you have a proper email list attached to it, because there are multiple ways through which you can actually build a database of your own consumers and patients. Basically, like you will have an HAS, and health information system, like Practo or any appointment making tool, where you get the demographic details of the patient. We get the demographic details like the age, sex, and then what to say, like rest of the details like their profession, email. So once you tend to build that particular email list, what you can do is you can start sending them a lot of informations through that email, and there are many tools for it. So there are many tools like SendGrip, MailChimp. So once you build the patient email database like 2000, 3000 or 4000 like that, you can try approaching certain people who can do the email marketing for you, and you can start sending emails. And in the emails you can see, even now you can see, sir, like when you open the email in Gmail, you get a special tab called social, and Gmail is working to give you something called health also. After COVID, they have been working on something where you will see a special tab like personal, social, promotions, and then health. So under health, maybe you will get a lot of email stuffs where you can engage with any healthcare influencer or healthcare professional to take care of your health. So you can try working on those email marketing for that matter. And then comes bulk SMS. But even though SMS is very traditional, nowadays it is becoming WhatsApp marketing. So rather than SMS, you can try integrating WhatsApp. You can start using WhatsApp for that matter. And then what you can do is mobile ads. So I'll on the forthcoming slides, we will try to explain you the difference between the benefit of implementing a traditional marketing and the advantage you get after implementing a digital marketing. I have few slides to explain that also. So you can see once you open any website for that matter. For example, you normally every morning you read a news portal. There are many online news portals nowadays, like let it be a daily like Dinatandi or Dinamalar, or even some short news portal like In Short. There are many news portals. So you have a habit of reading those news portals in the morning. Once you do that, once after every 2 or 3 news or three pages, you will find one ad for that matter. Even in Facebook, you can see, even in Google, you can see any software you use for that matter. Once after you start consuming information, in between, meanwhile, you will be seeing a lot of ads getting populated in those articles. So that is achieved using these mobile ads technology. So display and mobile ads technology, and predominantly Google is the backbone for such a kind of ads. Even Google has a separate tool for it for that matter. It is called Google AdSense and Google AdWords, where you can go create an account, spend money so that your ad will be distributed to many people. So you can achieve you can do your ads using mobile ads. And influencer marketing, sir. What is influencer marketing? When Dhoni talks about fitness, he becomes the influencer for fitness. So he is the right person to talk about fitness because he's being a 42-year-old cricketer. He is still into cricket and he is very fit. We know that for a matter. So you can choose right influencers to promote certain things. So that is called influencer marketing. You can see a lot of celebrities becoming influencers, and this is becoming more viral nowadays. For your own website, for your own radio ads or video ads or any ads for that matter, trying to use influencers and putting it on a digital platform to achieve. So that is also in trend now. So that is called influencer marketing. And comes the video advertising. Videos, even we started this session with a video, because you'll become more kinesthetic when you see some video for that matter. So video advertising is going to be the top element which we need to embrace when it comes to digital marketing. So these are the main digital marketing tools or types which a healthcare profession or a healthcare professional can try to implement in order to achieve your own goal for that matter. So this is the basic of digital marketing when it comes to healthcare. Yes. So here comes the slide where I wanted to explain few things to you all. It is very simple, sir. For example, I will try to differentiate between a traditional marketing and a digital marketing with one common use case. Okay. When you are driving down on a highway, you tend to see a lot of billboards for that matter. Maybe you see a jewelry ad, maybe you see a textile ad for that matter, let it be Chennai Silks or Gazana or anything for that matter. What you do on the move, or even if suppose you're standing on a signal, you just look at a billboard, you extract or you consume information from the billboard. Am I right? Definitely you'll be consuming information. What does it talk about? It talks about the brand. It communicates something about that brand. It will talk to you about the offer. It will talk to you about the product, and also it has an address. Basically, like they'll explain you where the store is. So you are consuming information in a kind of marketing using a billboard, right? When the same thing happens, when the same design, because people use for Adobe or any other tool to design that particular billboard, and they put it as a billboard, as a hard copy, and then you consume information. That's it. There is a disconnect. You consume information and then you travel where you wanted to go. The billboard will be standing over there. But the same billboard, which is the design, is going to be converted into an image or a display ad. And wherever you go, for example, not digitally, sorry, not physically, when you're virtually traveling with your gadgets, when you go to Facebook, the same ad is coming. When you go to Google, the same ad is coming. Or you're going to some other website also, the same ad is coming. What you tend to do? It's very simple. At least you will touch that ad and consume more information, because there will be something called call to action button, like learn more, click now, contact us, buy now. You could see a lot of click call to action engagements which happen in a digital marketing. Once you click that button, whereas in the billboard, once after the billboard is kept, maybe you can contact that particular person who has been, maybe that media agency who kept the billboard, and put them a question. For the past 14 days, the billboard is physically present in the road. Can you now give me an information like how many people saw that, and out of which how many people are male and how many people are female, and out of which can you give me an age criteria between 18 to 35, how many people saw my billboard? The person cannot give you information, right? Because you're consuming the information, you're just a passing cloud. So this is the disadvantage of traditional marketing, which has been embraced beautifully by digital marketing now. But the same digital copy being circulated in a digital forum, you engage with that advertisement. Just you click. What happens when you click that ad using your Facebook profile, using your Twitter, using your YouTube account? Automatically he will know there is a guy called Subhash, age 36, sitting in Coimbatore, who is into tech business, now talking to clutch people. Have read that ad. All this information will be passed on to the promoter. So what happens? They will retarget you. So and then he is not going to leave you. Once after you engage with that ad, and if you're so curious, and again you go to the Gazana's website or that particular company's website, read more information. There is a tool called Google Analytics, which will say, Subhash now visited your store without knowing. I mean, without the promoter being knowing. We will think that he is not going to know. But me visiting that website, if I spend some 3 minutes or 5 minutes on the website, immediately someone sitting on the back end will know I have visited that website because of this ad. And again, I have started consuming information for the past 3-5 minutes, especially under this link. Maybe like there are many links in the website, right? So for example, you get into a physical store, the salesman will be there. You can walk in, you can do window shopping, you can come out, and then he is not going to trouble you. Only if you again get into the physical store, the salesman will be there to welcome you, do the marketing. But here in the website, what happens? Here in the digital world, what happens? You go into the website, you spend more time, you come out, again he'll be retargeting you. Very, very simple. One good example, just go to Google now, just check for nice biryani in Coimbatore. They'll never allow you today, being a Sunday. Until 5 o'clock in the evening, you will get all the ads from Zomato, Swiggy, and even pop-up notifications will come from Angapar, saying that like you can have a nice biryani today. This is all achievable using digital marketing, sir. So just to talk about digital marketing in a layman, it is achievable. So because like consumers are retargeted, wherever you go, they will follow you. So this is the best example to differentiate between traditional marketing and digital marketing. So the reciprocity is more and the gratitude is also more. So you can use all this. You can use Facebook, Twitter, YouTube, any digital platform for that matter to target an audience, retarget an audience, achieve your goal, create a funnel, make a sale, keeping it very simple. So the next slide. Yes. How do we achieve all this? So the way we have to achieve all this is, in order to embrace digital marketing, what should we do? What best things I have to do? So content is the king of digital marketing, king and queen of digital marketing, sir. Because like whatever you create, the content has to be attractive. If suppose you are going to create a digital flyer, a brochure, or you're going to write a blog in your website, you wanted to have wiki pages or some web pages for that matter, and even content in your website, wherever, because content is something like wherever you put, it is like water. It can change its own nature, right? If you want to present the content ugly, it will be ugly. If you want to present the content beautifully, it will be beautiful. So it is like water. So remember, like you need to have a lot of content creators. It is not just your designer. It is not just your developer or your digital marketing partner. Basically, any company who wants to embrace digital marketing should have good content creators. So let it be a blog writer or let it be a designer, because there are different types of content creators. Try to identify those people, hire or else outsource to someone who is good at creating content. Only when you have beautiful contents, because you will be talking to them on a raw platform, you'll be the functional master. You can give them a lot of information about your hospital, about the advantages, about your credits, credentials, whatever you achieved in the past. But with that raw information, you should have someone who can create beautiful content which can be presented in the digital platform. Only then you can achieve your milestone. So keep that in mind. Content is the very basic thing which has to be taken care of when it comes to digital marketing. And then what you can do is like, these are again like very basic rules which you have to follow in order to create a website. First, just try to create a website in order to embrace digital marketing. Once your website is done, then definitely you should have hyperlinks which will connect your website to your Facebook page, to your Twitter page, LinkedIn page. You can basically, these are the 5 big tools which you can embrace in healthcare, so that you attract more people and you can reach to billions and millions of people. So try to have your own Facebook page, Twitter page, LinkedIn page, YouTube and Instagram. This is again a piece of advice to embrace digital marketing. And web optimization is, for example, if you don't have a website, please create one. There are plenty of people available in the market who can create website for you. And if suppose you already have a website, just approach a very good digital marketing partner or a digital agency who can actually try to revamp your website, because website should follow certain basic thumb rule which Google talks about. Google has a SEO algorithm running behind it. Only if your website can align with that particular SEO algorithm, then both will integrate and work together, so that like the Google can actually come and crawl, take certain keywords from your website. For example, you claim you are the best pediatric hospital in Coimbatore and you have a lot of pediatric services already being delivered to the society. So you have to put all those information in form of content in the website, so that Google can come, crawl that information, access that information on a day-to-day basis, and it will take that information to the rest of the society and say, oh, this is the best pediatric hospital. So like you have to revamp the existing website based on the search engine marketing algorithm. And then if suppose you are not into completely into service where you are into pharma, or you are into hospital supplies, try to create e-commerce portals. Or even if suppose you couldn't create an e-commerce portal, nowadays it is on a click of a button, you can create a store in Amazon, you can create a store in Flipkart, you can start selling your own products if suppose you are into the health ecosystem. And content management system, as I told, in order to create content, definitely embrace a content management system, because the website can be created using many content management system tools. It is called WordPress. People used to say, I have created a WordPress website. And then some people will say, I have created a Joomla website, a Drupal website. But 95% of the world is using WordPress. WordPress is the best content management system which you can embrace in order to create a website for that matter. And finally, you people might have heard about the word called SEO, search engine optimization. So search engine optimization is nothing but what I told you earlier. When people come and search for certain keywords, you have to optimize your website in a way that keyword is getting listed in Google. So that is called search engine optimization. So you have to write down your own keywords. So for example, these are the 10 keywords that my patient or my consumer will actually type in order to search for my services. So you have to identify those keywords, because like you know what good things you do and what you're best at. So basically you have to write down your keywords and say, okay, like for example, like I'm KMCH, so I can say like I'm a multi-specialty hospital, I have so-and-so services. So you have to write down your keywords and put it in your website, which can optimize the search engine so that you get listed over there in any search engine for that matter. So this is called web optimization. And now, sir, finally, this is one good slide. This slide, I think the Clutch people will be sharing it to you. So already we have passed it to them. So this is the latest information which we have grabbed from the internet. For example, if you wanted to use Facebook, who can actually use Facebook and what it is best for and what is the downside of that particular tool? You consider Facebook, they have 2.7 billion users aged between 25 to 34. For example, your target audience, or for example, your particular end user is going to be between this demographical statistics, you can use Facebook because it has 2.7 billion users aging between 25 to 34. And the main purpose of using Facebook is to build relationships. And in order to, this is for a personal peer-to-peer for that matter. But when it comes to business, Facebook is the best tool to build brand loyalty. That is why you could say like it's best marketing tool. Don't expect sale out of Facebook, because like it will happen, but only 10% of direct sale happens using Facebook. But for Facebook, you can use 90% to create brand loyalty. It is basically a marketing tool for that matter. And the downside is it will have only limited reach because it's being polluted. When you have 2.7 billion users, you cannot expect all the 2.7 billion users to read your ad. You tend to spend more. But the limited reach, the more polluted, the reach will be very refined. It is limited. That is the one disadvantage of Facebook. And when it comes to Twitter, you see like there are very selective users. They still have only 353 million users. But who are using Twitter a lot is like who are aged more than 30. Maybe like Instagram is used more by very teenagers, like adolescent people. So Twitter is used to target people who are aged more than 30, and 68% male audience is there. Like most of the users are male, around 68% are male, and where it is basically a news and article conversation portal. Here you can use Twitter to do public relations. So if you are a healthcare startup, your marketing guy should use Facebook, your PRO should use Twitter. Can you just correlate every tool with your existing designation? It makes your job easier. It will make your life simpler. And then once after and then there is Pinterest and YouTube, maybe like YouTube, all your marketing people can use it. So this is one information which I would like to pass to you. And LinkedIn is again where you have a lot of professional people working on it, business development people, brand awareness people. So where limited interactions used to happen. So if you wanted to identify your supplier network, you wanted to identify someone who want to work with you as a partner, there you can use LinkedIn. So LinkedIn is basically such a kind of tool. And then you have Insta. And nowadays, even people have started using TikTok to promote ads. So I don't think so. Healthcare can embrace TikTok for that matter, because it's very polluted. It's a nasty platform where healthcare professionals will not like it. So this is one piece of information which would like to pass to you all. And finally, sir, I just thought of being vendor neutral. Even though we are into this particular business, wherever you go and to whomever you work with, we thought of giving you a small piece of advice, which we thought we could do to you. So there are two different approaches. Whoever comes to you, but please don't fall prey for any freelancer for that matter, because freelancers will work with you for a limited period of time. As I told you, digital marketing needs a strategy. It needs a marketing strategy written down for 3 months, 6 months, or 1 year. Please don't choose freelancers, because they'll vanish. They'll work with you for 3 months, 6 months, and then you cannot expect them to work with for many years. So try to hire a professional organization or a professional company. And then normally keep in mind, it is very simple. Nothing is complicated when it comes to digital marketing. There are two different kind of approach. One approach is an enterprise approach. Another is a basic approach. So always keep this in mind. If you feel you are an enterprise, you have more than 50 beds, 100 beds, or you wanted to become a multi-specialty hospital, you are actually on the roadmap of, you're working on that particular roadmap, try to have this enterprise approach. Like what you have to do, when you create a social page, you have to embrace more than 4 or 5 accounts when you have an enterprise approach. When you are on a small scale, you say, I'm more like a solopreneur. Because my strength is like my OP, and I have very limited beds, only just 5 beds or 10 beds, and I have just an observation room. But I still wanted to embrace digital marketing. Just try to use Facebook and Twitter alone, nothing else, and then try to create your own brand. When you wanted to become wanted to have a confined approach, have just 1 or 2 accounts, especially Facebook and Twitter, and how many posts you can do. The small size people can try to do minimum 3 to 5 posts, and the enterprise approach, you create a campaign and try to do that post. For example, you do a eye camp, and you're planning for a vaccination camp, or you're planning from a tribal camp. So your monthly calendars will have a lot of campaigns, right? So all the campaigns you can post it, inclusive of your text, pictures, and videos. Try to differentiate between that approach. And then the service-based approach, you can have 5 interactions per day. Invest time to interact with 5 people when you post something on Facebook or Twitter. And an enterprise approach, try to have minimum 25 interactions per day. Where you want to do 25 interactions, there that enterprise approach will have a people. But solopreneurs, you will not find people to do that. If you want to do it on your own, spend some time, like try to at least do minimum 5 interactions personally for the engagements happening in the digital marketing platforms. And minimum 1 blog you can do. The enterprise daily, they can do blog it. And email, SMS, and WhatsApps to minimum 1,000 accounts you target, so that you can multiply. And these people, they can do based on subscription, because enterprise already they'll have access to huge database. So that is a different thing. And lead generation, minimum try to do 10 promotional calls. If suppose you want to promote something, only then you can achieve. And here what people do is like they do offer based promotional calls, because they create offers or every week or every month. So that is the difference. And web optimization, at least try to have a minimum 5-page website for you, which can talk about your services and about your portfolio and reviews. And here they can have a 25, they can afford to have a 25-page website. And reporting is like try to have a dashboard, sir. So out of which what you achieved, you try to write down in an Excel or in a Word with however you can write, try to have a report in order to continue your process on a weekly basis. So this is one small information we thought of passing it to you. And finally, thank you, heroes. Yes, during this pandemic, definitely you people are the heroes. And it's my pleasure to be a part of this presentation for the past 30 minutes. Thanks for your patience, and we are open to questions. Thank you.
Thanks, Mr. Subhas. Actually, the Q&As will be lead to the at the end of the session. So before that, I would like to share some key points that I would be taking to home after your talk. So kind of the how the word of marketing has changed to the review-based marketing. So which actually forces everyone to make the impressions on the social media strongly. So that you have explained through your modern marketing funnel. So which was very impressive. And the ways of reaching customers through digital marketing. So obviously the Google Group ad sense and through emails and the influencing digital marketing is the key to mark our label. And the traditional marketing, the comparison between the traditional marketing and the digital marketing, of course, traditional marketing interrupts to clients in some case. Digital marketing, yeah, it has a lot of advantages. As you mentioned, that you are here and giving lectures to across the Coimbatore and also Chennai. So it gives value and in a short of time. So finally, the way we put our contents on the social media is which makes more difference than the in professional marketers. So thanks for those wonderful insights, which has definitely provoked many thoughts. And once again, thank you.
Thank you.
Yeah, well.